everyone, this is Jody from Opening the Door on Private Practice Facebook group for counsellors and psychotherapists and psychosynthesis.online. So earlier this week in Opening the Door on Private Practice, I posted about fees and whether anyone was going to raise them for the new financial year, and I thought I would respond with a video. And then I thought, I haven't really talked about fees before. So this video is actually on setting fees, and my next one will be on raising fees. So let's just have a look. What have I got here? So just to set the scene in terms of my experience, for those who don't know me, this is my 22nd year seeing clients. I've had two practices, one in London, full-time and part-time, and in Sydney, full-time and part-time. So when I got kids, I went part-time. But part-time was 18 clients a week. So I considered that part-time because it was 3 days, 6 clients a day. Which I don't do any longer. Okay, so some of you might do the math and think, how does this work out? Especially if you can see when I qualified. We took clients from year one, day one, if we wanted to. So we did a foundation year, which was all personal development. And then after that, we went into seeing clients, and we were very much nurtured all the way through seeing clients. So from 2001, I saw clients. Okay, so my niche is women, trauma, disordered eating, and the trance of unworthiness. And so this niche can attract different, same sort of clients, but different financial status. And what I mean by that is that, many people have trauma, and that trauma may result in a lack of self-worth where you're not really, where you're bummed out of school, and then you don't really go on to activate yourself in life in terms of a career, and maybe you're not feeling very worthwhile. I know myself, when I went to London, I was very like that, eating disorder, drug addiction, working for £3 an hour, and not really thinking I could amount to anything much more than that, to be honest. And then gradually realizing my worth, and then becoming a therapist, and then maybe I could do this. So you've got that end of trauma, and then you've got the other end where you can get people who are highly perfectionistic, highly academic, workaholics, that have worked their way all the way up to like CEO and whatever else, and then maybe something punctures the false self, and then they end up in therapy. And so you working with people who are earning very little to $500,000 a year. So it's always been a bit tricky for me in terms of how I set my fees, because on the one hand I was seeing young women in retail and waitressing sort of jobs, and then having a CEO, so these are earning like, $17 an hour, versus a CEO of a top 10 company who's earning $300,000-$400,000, and always finding it tricky like that. So one of my mentors, Jarlath Benson, he trained me in psychoanalysis in those topics within our psychosynthesis training. He used to charge a percentage of people's earnings, and that's how much they paid for their therapy. So socioeconomically, that kind of balanced things out, which I think, could work for some people. Okay, so however, I do aim for 27 to 35 with disposable income. So people who can afford therapy. Private practice is going to be very tricky if you choose a niche where people don't have disposable income to spend or money to spend on therapy. So for many years, when I moved home to Australia, I just charged what everyone else was charging. I looked on, Psychology Today or whatever it was back then. Everyone's charging $100. That's just what I'll charge. I didn't think anything of it financially, of what that was going to cost. I guess I'm in a privileged position where I'm married, and my husband is a primary income earner, so I didn't really need to think of it. So I do come from a privileged position in that respect, and then I'm not supporting myself like a single parent or something like that, which I know some of you are. So nowadays what I do is I've worked out how I want to do it. I don't just copy what everyone else is doing. And what I do, because of my years and years of experience and professional development and the amount of money that I've spent on professional development, I thought, and also I wanted to not work as many hours, is I have a split fee system. So what I do is I charge one fee for my weekly psychotherapy clients, and then I charge another fee for anyone else that comes to see me. It might be parent coaching, private practice business coaching, my soul sessions, supervision, ad hoc therapy. So maybe someone wants to come back for 2 to 4 sessions or 10 sessions or something, and it's not weekly because they've already completed their weekly therapy with me. They are all set at a much higher fee now, and that is how I offset keeping my psychotherapy clients slightly lower. And to be fair, it's still not a low fee. It's not low cost or anything like that. It's still probably one of the a higher sort of fee. So how I work this out, I base my fees on the number of hours I want to work. So at the moment, that's 12 weekly psychotherapy clients with some ad hoc private practice business coachees and some supervisees. The number of weeks I want to work, which is 40, and that works out at 40 because by the time my clients contract to 4 weeks holidays, I have 4 weeks holidays, so that's 8 weeks. And then to make up the 12, they might be sick, I might be sick, I might have some CPD. So it roughly works out that clients come for approximately 40 weeks a year. If you're seeing short-term clients, you might work that out based more on just your holidays. But with long-term clients, that's typically what it works out at. And actually that in my psychotherapy training, we were expected to have 40 weeks a year of psychotherapy throughout our training. So we had to have between 4 and 8 years of psychotherapy, weekly psychotherapy, for at least 40 sessions a year. So that's where I work that out. Then I'm looking at the type of clients I want to work with, and what their financial status is, women, trauma, eating disorders, not feeling good enough, and factoring in their financial status. So just to segue into Medicare for a minute, least favourite topic. The current rebate is only available for, the reason I'm bringing this in is because a lot of therapists set their fees because of in line with the Medicare system and thinking, we're not getting Medicare, we need to make sure our fees are low so that people choose us. Like, there's all this story around it, which I'll get to later. Excuse me. So the rebate is only available for 10 sessions. I don't know about you, but I don't know anyone that works for 10 sessions or less. I think maybe some counsellors are, sure. But most of my colleagues work, this is still getting to know you, especially psychotherapy. So you only get it for 10 sessions, or you can go back and get another rebate, another, mental health care plan and get that extended. This is such a hassle. I just got one myself for something, and it was like, it's not for mental health, it was for something else, other health issue. And it is such a pain. Plus you have to pay to go to the doctor, $125. So, that's the cost of a therapy session. So, anyway, let's work this out. So a psychologist can get $90 back for their patients. Clinical psychologist around $130. APS, Australian Psychological Society, recommends a standard session recommendation is $280. So take away the $130 for a clin psych, that's $150. Take away the $90, that's $180. Is that correct? I think so. No, $190. The gap fee is more than what most counsellors and psychotherapists are charging anyway. I charge $180. I charge $180 for my psychotherapy clients. So that's exactly the same as a psychologist. And some people might say, well, a psychologist training is longer. Well, actually, my training was for 8 years. By the time I completed, it was 8 years. And I know with counsellors, and this is a big hoo-ha at the moment, I know with PACFA, they're raising the standards to degree and above, which I agree with at some level. I think that does bring complications for counselling and psychotherapy being midlife career change. So I think that can be problematic for some people. Yeah, so I don't want to make that about this, but yeah, it's complex. But I do think if we want to sit next to psychologists and social workers in that in the work field, then we're going to have to raise the standards to that. So yeah, so most counsellors and psychotherapists are charging less than the gap fee anyway, and some of us are charging that high end. So using the Medicare as a determining factor for setting your fees is flawed, I feel, except to highlight that using Medicare is not giving you free therapy. You're actually paying a gap fee of $150 to $190. Yeah, and actually that's the standard recommendation. So some might charge slightly less, but there's certainly some charging more. My clin psych charges $3 something for our family thing that we go to. So, that's, we must pay more than that with the gap fee. Anyway, let's get back to the setting fees. That's just to prove a point there on that. Okay, so setting fees is a complex process because we're taking all of these things into consideration. There's other ways to set fees where you just set it on what you want to earn, and we're going to come to that later. But if you want to take all these things into consideration, it's quite complex. So first of all, number one, research the market. So look at what other therapists in your area are charging, and just check out their fees. Some therapists don't put their fees on their website. I'm personally not a fan of this. I like to be very clear with clients so that we don't get into this whole spiel and then they're like, oh, I can't afford that. I always tell them therapy with me is weekly and this is the fee. You might work differently to that, that's fine, but be upfront. I think it just saves time for you anyway. I know they do discovery calls. I feel like this is very coachy sort of behavior, and it feels like salesy to me, which I don't like at all. It makes me feel a bit cringe. Okay, so then define your ideal client niche. Determine the types of clients that you want to attract. Are they seeking individual, couples, family, or group therapy? Obviously, you're going to charge differently for different groups. Some people charge the same hourly fee for everyone. My couples therapist many years ago, our couples therapist, not just mine, she charged more than my individual therapist did. So you need to think about that as well. Okay. But again, in your ideal client niche, you want to be thinking about people who can and who are willing to pay for therapy. This is why I think if you're getting Medicare clients ring up, it's not they don't want to pay. They don't want to pay for therapy, I've found. Some are just not educated because that's the first place the doctor goes is to refer to a psychologist. But I find people who come to me really value therapy and they value what I've written and they really want to pay. Well, they don't really want to pay, but they will willingly pay for the therapy. I see people for a very long time. I've had, I think my longest client at the moment is 2014, with a couple of little breaks in between, paying my full fee. So there's people out there who are willing to pay full fee. I'm one of those people. I've been with my therapist since I think September 2020, pandemic. And, I pay her the full fee. So likewise, people go to all sorts of different alternative therapies. They pay the full fee. So there are enough fee paying clients out there. You just need to find the right niche. There's a couple of niches I think that are a lot trickier. I know when I was going through IVF, I would rather put my money towards IVF than I would towards a therapist. Look, I personally didn't do that, but my colleagues who I was going through IVF with, if you can afford one or the other, you're going to put the money into IVF, not into counselling. So just be mindful of that. Okay, you might assess your qualifications, your experience, your level of education, certifications, your CPD that you've done, how much you've specialised. You know, I've spent a shitload of money over the years to specialize in being at the top of my field. You know, when the pandemic broke out mid-flight to Dallas, I was on my way to do a training in North Carolina, rather, in somatic psychotherapy with eating disorders, which was very, we didn't have that training here. So in terms of when I set my fees, I'm thinking about, you know, I left my family for the week. I spent on airfares, going overseas to become the best in my field at a certain skill and technique, and that nobody else had. So I can charge accordingly for that. I just didn't intend to get caught when the World Health Organization declared pandemic mid-flight. That made it all a bit trickier. Okay, so set your rates based on the previous factors. Determine an hourly rate for your services. And just a note here, I don't charge packages. I see some therapists setting that I think they think it's going to get clients in or something. I think it can become very tricky setting packages for clients because of the transference that can occur in that. So that's not something I recommend. I do that with coaching clients because it's a set number of sessions, and you know, being very careful around what the cancellation fee is with that. Coaching only, in my opinion. Okay. Evaluate and adjust. Monitor your fee strategy and assess whether it's working for you. I raised my fees after the pandemic to, I suppose, very high. I didn't have any shortage of getting clients. I just found after 9 months, I'm really not gelling with this clientele. Historically, I would have worked with that no matter what. After the pandemic, I thought, do you know what? I'm homeschooling. I've got 2 kids at home, emotionally managing the pandemic. I've been at this 18 clients a week for some time. I actually don't have the capacity for this type of client. And so I lowered my fees slightly, and voila, perfect match again. Perfect match. So just see how things go sometimes. It's not as clear cut as what some people would have you believe, I think. Okay, so how to work your fees out, about what you want to earn or what you need to earn. So work out your budget, first of all, home budget and business budget. How much would you like to earn? So I'm going to set this on being 120K. How many weeks a year do you want to work? Let's say 40, because we've worked out that that's kind of what it works out at. How many sessions a week would you like to work? So the majority of people, a full-time week would be 18. I hear 18 to 20, 18 to 25. I think over 18, most people are probably doing CBT or EMDR or some other skill-based sort of therapy, not so much depth psychotherapy or depth therapeutic counselling. And I do think that that's, there's probably more of a capacity for more clients doing that. Not always. So let's assume 120K a year. You're going to divide that by 40 working weeks, which equals $3,000 a week, divided by 18 clients a week, which equals $167 per client. That's what you need to charge. So you're going to charge $165 or $170. I think $167 sounds a bit weird. Yeah. So let's go through that again. 120K a year is what I want to earn. 40 working weeks equals $3,000 a week, divided by 18 clients a week equals $167 per client. Now, clearly, if you only want to see 15 clients a week, the fee's going to go up for that. You know, maybe, I don't know what that works out, 190 or something like that, maybe, which is what the gap fee is for psychologists. So why not go ahead? Okay, if you charge $125 at 18 sessions a week times 40 weeks, you're going to earn $90K a year. And don't forget, because you're only doing 40 weeks, you're covering for your losses and your holidays and maybe some super in there or whatever. I haven't even talked about super, but obviously that needs to be included in your budget as a sole proprietor. So if we were to put that up to 150 at 18 sessions, I'm just going in between the 175 and the 125. I guess that works out at about 100K a year or something like that. So that's how you work it out. So you can either factor in all of those things, or you can go purely on what you would like to earn. Either is fine, whatever suits you better. I do a combination of both of them. So yeah, it's important to remember there's no one size fits all. So play around with it a little bit, and come on over to Opening the Door in Private Practice and join the conversation. I'd love to see whether this was useful or not, or whether you disagree with what I'm saying. Okay. And what I'm going to do, actually, I will put my ideal client worksheet in the comments. That's available on Etsy. I think it's still only $9.99. Really, really in-depth form to figure out who your clients are. What I knew from doing that was things like working with parents of young children is really not a great niche for me, because I like people to come weekly. I like working long term, and parents are time poor, quite often have a mortgage. Like when you're working with 27 to 35-year-olds, maybe they haven't settled down yet. I know for me, 27 is when my eating disorder was really, it stopped working for me. So I was desperate to get help. Really, at the time, I thought I was desperate to lose weight is what the issue was. But then I realised I had an eating disorder, and that's why I was really in therapy. But around that 27 age is when people are, who am I? And that's the kind of person that I really like to work with. I don't like working with mums and bubs. I don't like working with, not that I don't like working with them, but I just think it's too hard. It's too hard for the kind of practice that I want to run. And actually someone posted recently in Opening the Door about, do they let babies come to therapy? I think the question was. And I'm one of the people that doesn't. And that's fine if that's how you want to work and you want the mum and the bub to come to therapy. But, you're thinking then about, is this person going to be a reliable client? Are they going to, cancel last minute because of sickness? And of course, we all have clients who cancel. But if you're one of these people who needs to earn a certain amount to survive, then you really want to make sure that your niche is on point with that. And yeah, I mean, and sometimes parents have help, for example. So you might be, I'm just thinking of someone else, someone that I've coached, and because of separation, the clients often are going through a financial separation. Well, there's always going to be people in that group of people who are at a higher financial level anyway. So I guess don't feel like you have to set your fees according to, like, just say, for example, I want to work with this niche. I think that's my problem that I used to do. I used to always go by that lower financial status when I didn't really need to do that. And maybe the way around that is to do like what I used to do too, is having 2 sessions a week at the $100, and then everyone else is at $150. So, there's ways of working around it, I guess is what I'm saying. I could go on about that forever. There's so many different versions. Okay, I'll stop there. Okay, I hope this was useful. Come on into the group and we'll see you there. Okay, bye.